Good afternoon, everyone. My name is Tarnika Manning with the Metropolitan Chicago Breast Cancer Task Force. To learn more about our organization, please reach out to us on our website, which is chicagobreastcancer.org, or give us a call at 312-942-3368. We're also on social media, where you can connect with us on Facebook or Twitter, where our handles are MCBCTF. Thank you for tuning in to our network, our channel. Today, we're watching a television program brought to you on cable channel CanTV 21 and online at cantv.org/hotline. During our show, we discuss issues related to breast cancer that affect women here in Chicago. Today, we have our guest, Karriem Watson. Karriem is with the University of Illinois Cancer Center. Karriem is the Director of Recruitment, Retention.
Actually, a little different.
I'm like, what you got?
Yeah. So I'm the Administrative Director of Community Engaged Research.
So your name, your title changes all the time.
My title
it's always long.
It's always long. The title change. So the sum of it, I'm the Director of Community Engaged Research and Implementation Science for the University of Illinois Cancer Center, but also the Director of Community Engaged Research for Miles Square Health Center.
Awesome. All right. So today, Karriem is going to tell us all about the UI Cancer Center. So please tune in. We have a lot of great information for you. All right. So thank you and welcome.
Thank you. Thank you for having us.
So like I said, he has a very long title and a large background in cancer. So tell us about your background, how you became affiliated with UIC.
I'm an alumni of UIC, first of all. So I first became affiliated with UIC actually as a graduate student. I worked there actually for a brief period as a clinical trials coordinator, coming from the industry in clinical trial industry, working in clinical trials in diabetes. But when I was working in clinical trials, I always had a passion for communities of color, underserved communities, not just communities of color, but whether those underserved communities are rural or in underserved areas was one of my passions. And so when I found out about UIC and the great work that they did as a public institution, I was immediately attracted to them, and a professional opportunity opened up, and I found myself there organizing and coordinating brain tumor studies, stroke studies, and other studies. And that led me really into thinking about how can I increase the number of students who look like me and who are from areas like me, not just people of color, but also from people from rural communities, people who understand what we call the social determinants of health. And so I really became active in workforce development and started working with the urban health program at UIC. And that led to where I am right now, actually, in the Cancer Center, where we have a comprehensive community-focused cancer center that focuses on all the things that are important to me, whether it's research, screening, prevention, education, clinical trial, and including in research, but also workforce development. How do we ensure that there's researchers, students, clinicians who understand the priorities of the communities that we serve and how they develop their research agendas around those priorities?
Great. All right. So tell us about the University of Illinois Cancer Center.
Yeah, so the University of Illinois Cancer Center is what we think of as a unique model and a concept of a community-focused or community-based cancer center. And some people say, well, what does that mean to be a community-focused, community-based cancer center? What it means is that in this 21st century model of a cancer center, we like to think that we've done a paradigm shift. So traditional cancer centers are primarily focused on research and focused on clinical care, which are extremely vital. They're vital to the care of the community. But that happens at the epicenter of that care is at the academic medical centers or at the cancer centers. And our vision, created by our director, Dr. Robert Wynn, was to think about how can we better serve the communities. And so in thinking about, instead of trying to increase the flow of the communities to us, his model as a community-focused cancer center was to increase our flow from the institution to the community. And we're very fortunate at UIC, the University of Illinois Chicago, to have an innovative leader like Dr. Wynn, who happens to have a dual role as both the Cancer Center Director, but also as the Associate Vice President of Health Affairs, Community-Based Practice. And what that means is that he sits in two vital areas in the community. He sits in the area of the Cancer Center, but he also sits in the area of our ambulatory care sites, one of which is our Miles Square Health Center network, which is a network of 13 federally qualified health centers. So as a community-based cancer center, we have a very intimate relationship with our FQHC sites and even our community partners, which one of is the Metropolitan Chicago Breast Cancer Task Force.
Great. Yes, we do. We have a great relationship. So we love having our partners on and highlighting the great work that they do. So.
Yes. And we thank you all. 'Cause, without our partners, I mean that as part of being a community-focused cancer center, it's truly based on our community members, but also our community partners.
Great. So what are some of the reasons for creating this comprehensive cancer center that is community focused?
Yeah, the first and most important reason is the community. It's the patients. When you look at the cancer statistics, whether it's incidence, those newly diagnosed, or mortality, those who die from cancer, you look at where those incidence numbers and mortality numbers are the greatest is often in the communities that are underserved, do not have access to care. They're not located near or within medical centers where we're often located. And it's often people of color. But it's not just about race and ethnicity, it's also about geography too. Because you look at some of your rural numbers with the incidence and mortality, and you see some of the same rates and disproportionate rates. So that was Dr. Nguyen's vision. When he first came here from Colorado, his vision was, how do we ensure that the care, the research, and even the navigation is happening where the need is the greatest?
Okay. Yeah. So you mentioned Dr. Nguyen wears dual hats. So there's several departments that make up the Cancer Center. So can you explain who is part of the Cancer Center team?
Right. So the Cancer Center is unique, and typically, a lot of times when people think about the cancer centers, they think just research.
Yeah.
They think of cancer centers, they think of research, and that is true. But in a community-focused cancer center, we have several different areas. So we have a behavioral health area that focuses on diet behavior shared resources. We have an area that is committed to clinical trials, our clinical trials office. We also have a large commitment to basic science research as well. And then we have a great collaboration with our clinical departments.
Great. All right. So in addition to your comprehensive team, are there other facilities and organizations that you partner with other than the task force?
Definitely. One of the things we created when Dr. Nguyen came on board was his first question to us was what place exists where the community partners and the academic partners can come together to address the cancer specific needs of the community. And when he told him that on campus there wasn't really an entity, that was his first task from our office, was to create that. So we created the Community Campus Cancer Collaborative, which we call the C4.
Oh, okay.
And as part of the C4, what we did is we reached out to academic partners and community partners who have a vested interest in cancer research, cancer engagement, or the broader social determinants of health that impact cancer outcomes. And Miles Square, being our ambulatory care network, was one of the key sites where we chose to house that Community Campus Cancer Collaborative.
So where's Miles Square located? I know.
Miles Square is actually, it's interesting. Miles Square is a network of clinics, but our flagship site is located at 1220 South Wood Street, which is on the corner of Wood and Roosevelt. So hopefully if you drive by, you'll see that it's a new
beautiful building.
State-of-the-art building that's a comprehensive FQHC. We even think of it as a hybrid FQHC because we're very fortunate to have a mammography machine within our FQHC, where we work with the task force very closely in your project Beyond October, to make sure that uninsured or underinsured women are navigated to free and affordable mammography screening. So.
We always get that comment that the people attend Miles Square, and it's like, which one? And people don't know where there's more than
we have sites. Like I said, we have 13 sites throughout the city. So our last statistics show that we service about 51 of the 77 Chicago neighborhoods, Chicago community areas. Yeah.
Awesome. All right. So are there certain cancers that the center finds to be more problematic or putting more attention towards?
There are certain cancers that we put attention towards, but we don't want to say that just because these sites are the ones we put attention towards, that other cancers are not priority area. Because the unfortunate thing is that in Chicago and in the state of Illinois, even if you think about cancer statistics, you can pretty much pick a cancer and we're leading the chart in those cancers. So we do what's called an evidence-based engagement model, and what that means is that we don't pick our cancer sites just based on what our researchers are doing. We actually looked at the data. So we looked at our organization, data given to us by the Chicago Department of Public Health, the Illinois Department of Public Health, and said, where are the cancer statistics that surround our community areas? And we looked at where incidence and mortality rates were greatest for those sites. And to no surprise, we found disparities primarily in breast cancer, incidence and mortality, colorectal cancer, prostate cancer, cervical cancer, which is surprising to a lot of people, but cervical cancer, and then cervical cancer we also lumped into their head and neck. But the one that catches most people off guard and surprised that we're focusing on is lung cancer.
Really?
When you think of people are often surprised that as a cancer center we have such a large emphasis and focus on lung cancer. But when you think about the cancers in the state, you combine the mortality rates for all the other cancers. If you combine breast, colorectal, prostate, and even pancreatic cancer, the mortality rates for lung cancer is still greater than all those combined. But most people don't know that. There's not a whole lot of walks for lung cancer. People don't know that. We know pink for breast cancer. We know blue for prostate cancer. But people don't know the color for lung cancer, nor do they know that there's a walk for lung cancer.
All right. So, we're breast cancer focused.
Yes, yes, yes.
So tell us about what University of Illinois Cancer Center is doing to fight breast cancer.
We are doing a lot to fight breast cancer. We are very, very fortunate to have some of the country's best and brightest in terms of breast cancer researchers, and we're also very fortunate to have in the city of Chicago some of the best and brightest in terms of community partners and community advocates. One of the main things that we're doing right now is screening and navigation, increasing the number of women who get a mammogram yearly.
Yes.
There's a lot of data out there. There's a lot of misconceptions out there about who should be getting the mammogram and when should they be getting that mammogram. And we actually partner with the American Cancer Society, the Metropolitan Chicago Breast Cancer Task Force, and we recommend that any woman 40 and older gets a mammogram every year. But beyond the age and beyond that, we also recommend you have a conversation with your primary care doctor about family history. Is there anyone in your family, particularly a first-degree relative, who's had a history of breast cancer? And how old was she or when they were diagnosed with breast cancer? Because what we really promote when it comes to our breast cancer screening is navigation through primary care. Making sure that your doctor knows your family history and that you know your family history. What did your grandmother die from? Did she have breast cancer? Did she have any type of cancer? Did she have cervical cancer? Did she, if your mother or first degree relative did have a breast cancer diagnosis, did you get genetic testing? Did you get genetic counseling? And there is a difference between genetic testing and genetic counseling. So we are really fortunate to have a genetic counseling center at the UI Cancer Center that is comprehensive, that focuses on family history and familial risk assessment. And so we are very adamant about making sure that we navigate women to not just breast cancer screening and treatment, but also to breast cancer care and family history risk assessment. Other thing I'd like to highlight in terms of breast cancer is that we're fortunate within Miles Square to have a specialty care service around breast cancer. So through Dr. Alejandro Perez Tamayo from the Department of Surgery, the second and fourth Wednesday, we actually have a breast clinic consult within our FQHC.
Oh, that's cool.
Yes.
I didn't know that.
Yes,
So I learned
yes,
something today.
Yes.
All right. So I know there's target areas here in Chicago that you are putting a lot of attention to and focusing on.
Yes.
Can you tell us about those areas and why those areas?
I can. I'm really excited about a new and emerging partnership that we have. Is actually with the Greater Roseland Breast Health Collaborative, which I know the task force is a part of as well. And the reason we're focusing on Roseland and really excited about that relationship is because when you look at the population shifts in Chicago, what you see a lot of is like a lot of the population moving south and to the southern suburbs. So it's not even just about Chicago anymore, and that's why the task force, I'm happy that you have the name Metropolitan Chicago Task Force. What some people may not understand what that means is that your task force goes beyond the boundaries of the city limits and really goes to the places where we want to go, and to the southern suburbs and even some of our southern Illinois. And
we go to Lake County too. So
Exactly.
we're everywhere in the Chicagoland area.
And so you think about the South Side, it's definitely one of our partnerships. And when people ask us about our catchment area, we've been encouraged to utilize this model that Dr. Nguyen has around in our ambulatory care sites. So we have a site in Inglewood. If you look at the breast cancer incidence and mortality rates, Inglewood has some really high incidence levels. And so we target our FQHC site in Inglewood. We're in Back of the Yards. There's another one of our site that we target. Cicero. And South Shore. And Maine, which is near West. And then also looking at where some of our school-based health centers and integrated health centers are located, like Humboldt Park.
Great. So I know with your community focused approach, you do a lot of ward areas. Why wards? That's very different from
That's a very popular question we've gotten. Why wards? And when Dr. Nguyen started selling this model of a ward-based model, we got a lot of questions from some people, and some people said, "Well, Chicago's a city of neighborhoods. We're community areas. Why wards?" And the answer was simple. It's really about accountability, and it's really about stakeholder buy-in. The beautiful thing that you have with wards is that, first of all, Chicago is very political already. We know that, right? It's a town of politics. But it's also a town full of active and innovative civic and political engagement. And the ward concept really comes out of the concept of building on the relationships we have with our politicians to really think about accountability and sustainability. So when you have a ward model, you have an alderman that is in that community area that has a vested interest in the health of that community area that make up that ward. And so you get to meet with that alderman and those other civic and political leaders and say, is this a priority for you? But what we found is that the aldermen have just been really receptive, saying that they don't receive this type of data. they don't get the opportunity to do evidence-based engagement. They don't get the opportunity to build their platform around the evidence, the data. And so what the ward-based model does is it presents to the alderman, it says, this is what the numbers show in your community areas that make up your ward. And then that gives them the opportunity to work with us in a collaborative nature to develop innovative screening interventions and navigation based on the data.
Great, great. And the words that I know you guys are working with are very different. So how do you connect to all these different words that are so very vastly different?
We have a team. I'm very fortunate and blessed to be a part of a team. We have our manager of strategic partnerships, Victor Lagroon, who works with the mayor's office and our city council to make sure that we have active relationships with our aldermen. We also have an engagement office on campus that we work with as well. I met with them before I came here today to talk about what aldermen have we met with, what are the aldermanic priority areas. We also work with the Black Caucus through the aldermen and also Latino Caucus with the aldermen to identify their health priorities. And so it's really through a partnership and a team effort.
So again, what are some of the wards that you work with? You mentioned
The numbers we work in the wards in Inglewood area, the Humboldt Park, South Shore, and back of the yards.
Great.
And
So again, very different.
And Roseland.
Very different neighborhoods, very different wards.
Yes. And so I
different leadership is kind of
different. Yes. So, but the problems are unique as well. Just like the wards are unique, the problems are unique. So why not? It wasn't easy, but it's the right thing to do at the right time. Even.
All right. So what services will someone receive if they were receiving treatment at the UI Cancer Center?
Some services that they will receive if they're getting treatment with us at the UI Cancer Center is first and foremost navigation to a medical home.
Yes.
The thing that we think is really important is to make sure that we're going to, of course, address their immediate cancer needs. If they come to us with a diagnosis already of cancer, we're going to immediately connect them to comprehensive specialty care through our oncology department. If they come to us thinking that they may have risk for a cancer diagnosis, we're going to address that screening and diagnostic needs. Diagnostic needs. But we're also going to connect them to a medical home. Because what that primary medical home does is it connects them to primary care.
Yes.
And so in the event that they do not have a cancer diagnosis, they're in queue to make sure that there's someone who knows their health history and able to follow up with them. If they do have it, that's still that level of follow-up that's needed.
We like to call it medical home base.
Exactly.
All right. So how do you get the information out to the community about the services?
You go out to the community.
All right. So how do you do that?
we do it through we say that we have 5 areas of engagement.
Yeah.
And one of our areas of engagement is community navigation. And what we mean by community navigation is really we have navigators. We also work with the American Cancer Society with their navigators in the hospital. And we are in the communities. Just this past 2 Saturdays ago, we were in Humboldt Park at an event called Hope Fest. At that event, we were fortunate and able to touch 700 women.
Oh, wow. That's awesome.
And of those 700 touches, we were able to do 126 one-on-one education one-on-one education about breast health.
Great.
And of that number, we were able to sign up 76 women for mammograms.
That is awesome.
Yeah, so you actually have to go to where the need is and do that type of navigation. And, if you think about June was Men's Health Awareness Month.
Yes.
So we were in South Shore at one of the churches in South Shore talking about prostate cancer, navigating men to free PSA screening. And that was actually through a partnership with Sean Trotter's group at Lurie Cancer Center. So even as a UI Cancer Center, we are not afraid of partnering with other academic institutions across the city.
That is awesome.
Yes.
Got to keep the partnership and the resources flowing.
You have to.
All right. So I know you mentioned another aspect of the UI Cancer Center is the academic center. So there's a lot of research that goes on.
Lots of research that takes place. And another thing that we did when Dr. Wynn came on board is he said, how do we identify the research priorities?
Yes.
So we actually, Miles Square fortunately did a Miles Square needs assessment because as an FQHC and as part of the Affordable Care Act, most healthcare entities are required to do needs assessments every so often. And so as a part of the Miles Square needs assessment, we looked at what the numbers showed us in terms of cancer needs. We then built a research council around those needs, and we presented to our research council and said, we need a group that can let researchers and academics know at UIC what our health priority areas are. And we presented those health priority areas to a group of researchers and said, we encourage you to develop your research agenda around these priority areas. And so we're very happy that we've had several grants submitted recently that were actually almost a CBPR model, like
Oh,
community-based participatory research model, or at the very least a community engaged model that was a different approach. Again, the research agenda built around the health inequities.
Great, great. So you guys have a lot of good stuff going on.
We do, and we don't ignore clinical trials. We have an amazing clinical trials office in our cancer center. We're very fortunate to have some key leadership there and getting out the awareness. I was just in Humboldt Park again at the Richard Daley Library talking to some people about the book, The Immortal Life of Henrietta Lacks. So some people may say, why was the cancer center at a book discussion about the immortal life of Henrietta Lacks? Because it's about the issue of medical mistrust. It's about the issue of diverse participation in clinical trials.
Yes.
How do we increase awareness and access, but at the same time acknowledge the historical mistrust that has happened in research? Because we know that only 5% of the eligible cancer populations participate in clinical trial, and that number is even lower for communities of color.
Yeah, I was going to say, minorities are very mistrustful of the healthcare system. That's one of our biggest barriers to get over as well.
And we got to be and own that. And a lot of that is rightfully so. The system hasn't always been accessible and hasn't always been culturally competent in the way we've approached issues in certain underserved communities.
Very true. So you mentioned that you wanted students to be more involved in the topic area. So what opportunities do you have for students at the U.S. Cancer Center?
Right now, if you go to our engagement office, you'll see about 9 students huddled into this little small space because we had about 13 interns.
Oh, wow.
Yes.
That's
13.
a lot of interns.
That's a lot of interns. Lots of medical students, undergrads, public health students in our cancer center this summer that were actually finding out about the cancer care continuum. We are fortunate to partner with the Hispanic Center of Excellence this summer, fortunate to partner with even the University of Chicago this summer for an internship opportunity for our graduate and medical students and undergrads even, to learn from every and anything about cancer research and cancer and community engagement.
Great. So students definitely get involved. If
Contact
you are interested.
us. Right. Contact us. We will expose you to more than what you thought cancer was about.
So you guys are out in the community a lot. So do you have opportunities for volunteers to be involved?
We do. We have tons of opportunities for volunteers to be involved. We love for volunteers to call our university volunteer office, call our community engagement office, and I'll make sure that number is accessible at the end of the show.
Yeah.
But also making sure that volunteers email us or call us about if you have events at your church, at your community area, at your mosque, synagogue, wherever you may be having any community event, give us a call. And whether you want us to come and participate or you want to participate in what we do, we love that.
Okay, great. So I remember you said that you wanted to make sure that people had access to the information. We're going to head over to your website right here. So this is where they go to get more information?
About Miles Square. And then we also have information about our cancer center. So that's our cancer center website at the University of Illinois. You can click there for information, and that's where our landing page where people can go to find out more about who we are and what services we offer.
And what website is this?
That's the University of Illinois Cancer Center. And the actual website is chicago.medicine.uic.edu/cancer center.
Great. And you can call here and sign up to volunteer and learn more about how you can get involved as a student.
And you can also give us a call, and that number to call is 312-996-7695.
All right. And then Miles Square is where you can go and get
information. Miles Square is where you can go get information about a primary medical home, and that website is hospital.uillinois.edu/patients and visitors/Miles Square.
Awesome.
long landing pages.
Is there any other information you wanted to share with our audience?
I think we really want to also share because we are here with the task force, we want to really promote our Walk-In Wednesdays, which happen every month. And this month's Walk-In Wednesday will be next Wednesday, August 12th. And the Walk-In Wednesdays are for 9 a.m. to 4 p.m. On the day of the mammogram, where we offer free mammograms to women. And you don't have to have insurance to qualify for this. And the reason that is because of organizations like the Task Force. We partner with you to make sure that women that are uninsured or underinsured are able to take advantage of our Walk-In Wednesdays.
So where's the Walk-In Wednesdays at?
The Walk-In Wednesdays is located at our Miles Square Main site, Miles Square Main, 1220 South Wood Street. Again, on the corner of Wood and Taylor.
Awesome.
I'm sorry, Wood and Roosevelt.
Okay.
Wood and Roosevelt.
That's right. All right. So again, this is a great information. Definitely check out their website. What's the website again?
The website is hospital.uillinois.edu, and you can go there and do a search for Miles Square.
Or you can just Google UI
Or you can just Google UI Cancer Center. Exactly.
All right, Karriem, thank you for being a guest today. There's a lot of great information. I love when I learn new stuff.
Yeah.
So,
And thank you to the task force for being a great partner as well.
all right, I'd like to thank you for watching today's show. Tune in next month where we'll again be discussing issues related to breast cancer. If you'd like more information about our organization and as well as the UI Cancer Center, check us out on the web at chicagobreastcancer.org or give us a call at 312-942-3368 or connect with us on social media on Facebook or Twitter where our handles are MCBCTF. Again, my name is Tarnika Manning with the Metropolitan Chicago Breast Cancer Task Force. Thank you for watching.